Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pheochromocytoma. Introduction. Pheochromocytoma is a rare type of tumor. It usually starts in the cells of one of your adrenal glands. The tumor is often benign, which means it is non-cancerous. Although they are often benign, pheochromocytomas can cause the adrenal gland to make too many hormones. This can lead to high blood pressure and many other symptoms. Surgery is the most common treatment. This program explains pheochromocytoma. It covers the symptoms and causes of this type of tumor. It also talks about diagnosis and treatment. The adrenal glands. The adrenal glands are found on the top of each kidney. Kidneys are organs located in the mid to lower back on both sides of the spine. Each kidney has one adrenal gland. The gland is shaped like a triangle. The adrenal gland makes important hormones. Some of these hormones are cortisol, aldosterone, testosterone, estrogen. Cortisol helps the body use glucose, a type of sugar found in the body. It also helps manage the body's use of protein and fat. Aldosterone helps control the balance of water and salt in the body. It also helps keep blood pressure normal. Testosterone causes the body to have male sex characteristics. Some examples are facial hair, a deep voice, and muscle growth. This hormone is mainly made in the testes. Some is also made in the adrenal glands. Estrogen causes the body to have female sex characteristics. One example is growth of breast tissue. This hormone is made both in the adrenal glands and the ovaries. The adrenal glands also make hormones called catecholamines. These include epinephrine, also called adrenaline, norepinephrine, also called noradrenaline. These hormones help the body respond to stress. They raise heart rate and blood pressure when released into the bloodstream. This happens in response to stressful situations. Symptoms. A pheochromocytoma sometimes causes the adrenal gland to make too many hormones. The extra hormones cause symptoms. High blood pressure is a common sign of a pheochromocytoma, but this does not mean that all people with high blood pressure have a pheochromocytoma. This type of tumor is rare. High blood pressure may be followed by low blood pressure. An episode of high blood pressure often begins with a change in breathing and a pounding heartbeat. Episodes may happen several times a week. They may last for 15 to 60 minutes at a time. Episodes of high blood pressure may happen after a change in position, emotional distress or anxiety, exercise, having a bowel movement, lifting. These activities may press on the tumor, causing symptoms to start. Other common symptoms of a pheochromocytoma are being extremely pale, excessive sweating, feeling shaky, headaches which are often severe, pounding or racing of the heart. Symptoms may also include anxiety or panic attacks, nausea or vomiting, pain in the lower chest or upper abdomen, sensitivity to heat, unintended weight loss, weakness.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Healthcare providers are not sure what causes pheochromocytomas, but they do know that these tumors start in special cells in the adrenal gland. These special cells are called chromaffin cells. Chromaffin cells are found in the center of the adrenal gland. A pheochromocytoma happens when these cells grow uncontrollably. Pheochromocytomas often only affect one adrenal gland, but more than one can grow in an adrenal gland. They can also affect both adrenal glands. Rarely, these types of tumors can happen outside the adrenal glands. This is because chromaffin cells are found in nerve tissue throughout the body. These tumors are called paragangliomas and may be found along the spine, in the bladder, in the heart, in the neck. Sometimes pheochromocytomas run in families or are part of an inherited condition, including MEN2, NF1, von Hippel-Lindau disease. MEN stands for multiple endocrine neoplasia syndrome. People with MEN type 2 have pheochromocytoma along with other cancers and problems involving hormones. NF1 stands for neurofibromatosis type 1. Pheochromocytomas sometimes happen in people with NF1. NF1 causes multiple tumors in other parts of the body as well, such as the skin and optic nerve. Von Hippel-Lindau disease is a rare genetic disease. It causes tumors and cysts to grow in the body. A person with this disease has a high risk of pheochromocytoma. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. A physical exam will be performed. You will also be asked about your family's medical history. This is because sometimes pheochromocytomas run in families. Many tests can help diagnose a pheochromocytoma. Blood and urine tests can show if certain hormone levels are too high. These hormones include adrenaline, noradrenaline, methanephrines. For the urine test, you may need to collect urine over a 24-hour period of time. If the blood and urine tests indicate a pheochromocytoma, then the next step is imaging tests. Often a CT scan of the abdomen is done. Other areas of the body may need to be scanned as well. Other imaging tests may be used, including MRI, MIBG scan, PET scan. Treatment. When treating pheochromocytoma, healthcare providers usually recommend surgery to remove the tumor. The entire affected adrenal gland is often removed. In most cases, signs and symptoms then disappear. Before surgery, medicine is usually given to control symptoms. Alpha blockers are first given to lower blood pressure. Beta blockers may then be given to control an irregular heartbeat. These medicines block the effects of the extra hormones made by the tumor. Other medicines may also be given to control blood pressure, such as calcium channel blockers. Your healthcare provider will decide which medicine will work best for you. In some cases, surgery may not be possible. If you cannot have surgery, you may take the same medicines usually given before surgery to control your symptoms.
Usually, pheochromocytomas are benign or non-cancerous, but rarely the tumor may be cancerous. If this is the case, then other treatment may be needed. This can include ablation, chemotherapy, radiation therapy, targeted therapy. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Pheochromocytoma is a rare type of tumor. It usually starts in the cells of one of your adrenal glands. The tumor is often benign, which means it is non-cancerous, but rarely the tumor may be cancerous. Pheochromocytomas can cause the adrenal gland to make too many hormones. This can lead to high blood pressure and many other symptoms, such as being extremely pale, being shaky, headaches, pounding of the heart, sweating. Healthcare providers are not sure what causes pheochromocytomas, but they can run in families. Blood and urine tests can be used to tell if certain hormone levels are too high. Then imaging tests may be done. Surgery is the most common treatment. Medicines may be given before surgery to control symptoms.
Thank you for using Explain.